Welcome to our today's health talk. And our today's health talk is going to be on the type 2 diabetes mellitus. In our previous clip, we talked about the type 1 diabetes mellitus, and we said in type 1 there is an autoimmune destruction to the beta cells or the cells of the pancreas, and therefore interfering with the insulin production, an hormone that then facilitates the uptake of glucose. So when the production is interfered with, then there is an impairment with the absorption of glucose, resulting into a lot of glucose in blood, what we call hyperglycemia. Now in type 2 diabetes mellitus, what happens is that there is enough production of insulin by the pancreas, but then the body develops resistance to that insulin. And therefore the net effect is that there will be absorption of glucose. Since it is the insulin that facilitates the absorption of glucose, when the tissue develops resistance to that insulin, then there can never be absorption of glucose by the body cells. Now there are several risk factors to type 2 diabetes mellitus. Some of them are shared by type 1. Let's have a look at them. Number 1, we have age. And type 2 diabetes mellitus commonly occurs within the adulthood period. It can also occur at any age, but it's very common within the adulthood. And therefore, having an age of above 45 or 45 years and above predisposes one to type 2 diabetes mellitus. Of course, that comes in with other contributing factors. Number 2 are lifestyle-related issues. For example, being obese predisposes one to diabetes type 2. Being obese results into the blockage of various muscles that then can help in the uptake of insulin. And so when that happens, there will be resistance to insulin absorption. And when that occurs, glucose uptake is interfered with. Our next risk factor is being inactive, being physically inactive. So when one is physically inactive, then chances of one being obese is very high. And being active also stimulates the movement, contraction, and relaxation of various muscles that then can facilitate the uptake of glucose through insulin. Our next risk factor is race. Therefore, it's also scientific backup that being an African American, American Indian, just to highlight but a few, predisposes one to type 2 diabetes mellitus. It has been identified that majority or most people who suffer the type 2 diabetes mellitus belong to those particular races that I've highlighted. Our next risk factor is called diet, and consumption of excess glucose or consuming meals that are more sugary increases one's chances of becoming diabetic, particularly the type 2 diabetes mellitus. Now, having highlighted a few risk factors, let me also be able to characterize the various signs and symptoms of type 2 diabetes mellitus. How will you know that you are developing type 2 diabetes mellitus, or generally diabetes mellitus? Now, one point to note is that the symptoms of type 1 are shared across by type 2, and it may not be easier to differentiate the two just from blood glucose levels or just by the lab test. And therefore, further investigation in terms of history and examination still need to be done. So what are some of the signs and symptoms of type 2 diabetes mellitus. So of course I'll just repeat what we said in type 1. Number 1, we have what we call excess thirst, and that can be medically characterized or defined as the polydipsia. Number 2 is excess hunger, which is called polyphagia. Number 3 is excess or increased frequency in passing urine, which is of large volume, and that is called polyuria. The next thing can be unexplained weight loss, and the next thing can also be fatigue. We can also have recurrent urinary tract infection or sometimes recurrent UTI. We can also have difficulty in wound healing. So one may have wound or even a cut, and that becomes so difficult to treat. So delayed wound healing, one of the reasons that may be behind it could be high blood sugars, and in this case, diabetes mellitus. And therefore, should you come across any of those symptoms and signs, or experience any of those symptoms and signs, kindly visit your nearby health hospital for further investigation, examination, and then management. The next thing that I would like us to maybe take note of is that type 2 diabetes mellitus is the most common type of diabetes, and it accounts for about 90% of all the diabetic cases. Type 1 accounts for about 10% of all the diabetic cases. In our next clip, we'll then be able to talk about the various differences between type 1 and type 2 diabetes mellitus. How can you know the differences? How can you know that chances of me that whatever I'm suffering from could be type 1 diabetes mellitus and not type 2 diabetes mellitus? So ladies and gentlemen, keep viewing our channel, for we'll be able to characterize all those that we've said. If you are watching us for the very first time, kindly subscribe, and until next time, it's goodbye from all of us.